Health Spotlight, presented by Community Health Network.
And in your Health Spotlight tonight, a simplified approach to treating scoliosis.
UC's Lena Pringle brings us the story of how a breakthrough procedure has changed daily life for one teenager.
Up to 9 million people are living with scoliosis, a condition where the spine curves sideways, causing pain and deformities. Traditionally, kids are put in back braces to try to straighten things out. If that doesn't work, fusion surgery is the next step, but it has limitations. Now, a new, less invasive treatment option is giving kids an easier way to ease their pain.
We share clothes.
We like to go to Target and spend money.
That's not all these two sisters have in common. They both have scoliosis. So does their mother and grandmother.
It's really uncomfortable. I can feel it all the time.
I was in a lot of pain.
The difference between the two, Irie hasn't had surgery, but little sis Ruby tried something new to straighten her spine, vertebral body tethering, or VBT.
It allows us to approach the spine differently in a way where we don't have to disrupt quite as many muscles and underlying anatomy. It also allows us to maintain the flexibility of the spine.
Through 4 small incisions, a pediatric orthopedic surgeon, Jaron Riley at the Rocky Mountain Hospital for Children, used a rope, similar to nylon, to tether the bones of the spine together.
And with the rope, we can tighten the rope, which allows us to straighten the curve to a certain degree. And so the curve will gradually get straighter and straighter.
Ruby had a 52-degree curve in her spine before surgery. After VBT, it was 18. She's pain-free and an inch taller.
I was really excited about it, and I felt normal for once.
Now, big sis Irie is hoping to follow in her footsteps and have her surgery this summer. Dr. Riley says spinal fusion used to be the only option, and it can greatly inhibit movement and flexibility. Right now, VBT is only approved for kids who are still growing, but Dr. Riley is working closely with insurance companies and the FDA to broaden those restrictions. I'm Lena Pringle for Wish TV, wishtv.com, and like us on Facebook.